We are live. My name is Gabe Howard, and I am the host of the Not Crazy podcast. And I am here with my happily divorced ex-wife. Is that?
No, I'm actually married, just not to you.
But you're happily divorced from me.
From you, yes. But if someone said to you right now, Gabe, are you married? Would you say, no, I'm divorced? Of course you wouldn't. You'd say you were married to Kendall.
I'm married to Kendall, divorced from you, separated from but now we're mental health.
How many women are you juggling?
I lost track. But now we are podcast hosts. We are the hosts of the Not Crazy podcast. You can find it at psychcentral.com/notcrazy or your favorite podcast player. And for the next hour, we are going to answer as many mental health questions as humanly possible. Depression, bipolar, anxiety, mental health advocacy, wherever it goes is wherever it goes. We'll try to get to as many as possible. Just drop your questions in the comment section below. Now, please, shorter questions just work so much better because we display them on the screen. Lisa, did we forget any instructions?
I don't think so. I feel like the instructions are the same, are fairly simple. I don't know. I'm the one who always messes up the technology, so you shouldn't ask me.
I didn't ask if they were hard. I asked if we forgot any.
Well, if I can't figure out what they are, I don't know that I can tell if we lost any.
This is the crux of Lisa and I's relationship. I'm like, hey, what's your favorite color? And she's like, I don't feel like I could eat right now. Nobody asked you about food. Well, food has a color. I'm like,
my least favorite food color is brown. It's true.
Lisa, while we were waiting for the questions to come into the comments, and remember, shorter questions work better. Let's go ahead and introduce ourselves. I've been talking pretty much nonstop. So Lisa, you're over this way now.
What?
Lisa, the floor is
yours. Hey, we were reversed. Why are we reversed? Usually I'm on the other side.
I don't know, but I think it's awesome. I've never been on this side before, so...
Yeah, but I've never been able to figure out the arrows. Yeah, we're completely hopeless now. I'll never figure out the high five.
Yeah, it's a big
we really... Is there a practice? There was some way we should practice this. It's almost like we don't practice enough.
Yeah, all right, introduce yourself.
All right. Well, my name is Lisa, and as Gabe said earlier, I am his ex-wife and the co-host of the Not Crazy podcast, which, as you can see, is available at psychcentral.com/notcrazy or on all fine podcast players. And that's really all I have to say. We are here to answer your mental health, mental illness, psychology questions. I myself have struggled with depression for most of my life, have been under very good control for the past many years. So interesting to see what questions we get today. How about you, Gabe?
My name is Gabe Howard. I live with bipolar and anxiety disorders. Of course, I'm Lisa's co-host over on the Not Crazy podcast.
He never says he's my co-host. Yay.
It is true that Lisa and I were married a long time ago. We are now happily divorced. And it was like 12 years ago.
You stole my youth. I'm trying to hold on.
I didn't make time pass. I have control, but certainly not that much. I do live with bipolar and anxiety disorder. I am a mental health advocate. In addition to the Not Crazy podcast, I am also the host of the Psych Central show, very popular podcast where I have experts explain things to my dad. Because I figure if my dad can understand psychology, mental illness, and mental health and learn from experts, that's a very good thing. So I'm really proud of that show. But here we are very excited to talk about the Not Crazy podcast, answer all of your questions, and hopefully we have some questions because that's about as much banter as Lisa and I prepared. So are you ready to see what is in the queue there, Lisa?
Yes, absolutely. Gabe is better at banter than me.
All right. They are popping up here. Oh, I'm reading a ton of them on here. Just need to find the right one.
Luckily, I'm not in charge of that because I get very confused with all the various buttons.
All right, Lisa, are you ready?
I am ready.
All right, and the first question is here now.
All right. Hi, fellow podcasters. Can we talk about PTSD, ongoing anxiety, and trauma?
Absolutely. Those are great questions. So the answer is yes. Yes, we can. That was an easy
Next
one. I like
question.
the easy
Done.
ones. All
All
right.
right.
So yes, please ask any question you want. Post-traumatic stress disorder, ongoing anxiety, trauma. We'd be happy to discuss it. Remember, shorter questions work better. All right.
Well, Gabe, you certainly have ongoing anxiety. Oh,
All right. Here we go.
that's
yeah,
our thing. Yeah. That's not a
Okay,
question.
Here we go. Yeah, wrong one.
All right.
My bad.
Okay, Stacy Tupper asks, I go to bed with a nice meditation time. Why do I wake up screaming with anxiety?
I think that we have to look at things like very separately, right? The meditation time helps you go to sleep. For example, if I can use an example from my own life, I have a very hard time going to sleep because ruminations, anxiety really just it goes in my brain. Did you get everything done? Did you lock the door? Why are you a failure? Why did that kid in the second grade steal your lunch? Just whatever it is. So it's really important to understand that the meditation allows you to go to sleep at night. Why you wake up with screaming anxiety is sort of like the reset. You've got a coping skill to go to bed, and kudos. That is awesome. I have many coping skills to go to bed, and they work for me. I'm glad you found one that worked for you. Now you need to find the coping skill to work when you first get out of bed. I personally find having that routine. I know exactly what I'm going to do. The minute that alarm clock goes off, I am on autopilot for the first 20 minutes of the day, and that really helps throw me and thrust me into the day. That personally helps alleviate my anxiety. Lisa?
I would say that I don't have any difficulty sleeping. I'm lucky in that way. I would agree that how you go to bed is not necessarily representative of how you're going to wake up. I would say that maybe decreasing your overall anxiety level might help with your level of waking anxiety. And I also do that, have a really rigid routine. I have absolutely the same rules every single morning. It takes me a lot longer than Gabe. I'm probably at about an hour. And yes, I get very upset if I don't have my Rice Krispies on time. So
you are Rice Krispie addicted.
Well, if I don't have them, I get upset.
I think that it's interesting that Lisa likes to wake up and have Rice Krispies, and she's very clear. This is one of the things that she does.
I've actually said to him, "It's Rice Krispie time. Why are you trying to talk to me?" Yeah.
Yeah, and when I wake up, I like to have Diet Coke. This is very, very important to me. But we mock each other. I'm like,
well,
you gotta get
fair,
up and have
fair.
Rice Krispies. What's wrong with you? And Lisa's like, you got to get up and have Diet Coke. What's wrong? And we don't realize that we're doing the identical thing. We've just swapped out the food stuff. I don't know what happened there, but I'm positive that Lisa's wrong. I'm
harsh,
positive.
Gabe, harsh.
All right, you ready for the next question?
Absolutely,
Remember,
next question.
you ask short questions in the comments now.
Oh, you worked it in with the thing. Nice. All right. So Katie Clark asks, have you ever experienced psychosis? How do you deal with it? I personally have not ever experienced psychosis, but Gabe?
Hey, isn't this week's Not Crazy podcast all about
actually,
my experiences?
Oh my God, I actually forgot that.
With psychosis?
Make sure you listen to the Not Crazy podcast, available at psychcentral.com/notcrazy, which, yes, today is all about Gabe's experience with psychosis.
Okay, I think people know that we're the hosts of the podcast. You're just annoying.
I only have the one thing. Sorry.
You remind me
Silence.
of the lady at the mall with the perfume that just follows you around and keeps spraying you with the perfume long after you said you don't want the perfume. The perfume is, of course, called the Not Crazy Podcast, which is available at Psych Central. No, I'm just kidding. So yes, I have experienced psychosis, and sincerely, over on Not Crazy, today's episode just happens to be about not only my experiences with psychosis, but Lisa and I were married
at that time.
At the time, and so it sort of does a nice job of going back and forth between how I felt and what I remembered, and of course Lisa's reaction to it, and
we had never really talked about this. Yeah, we had never really talked about this, so it was a little bit surprising how differently you remembered things. Which, well, I guess it shouldn't have been, because after all, you were psychotic. But even now, how differently you perceived it after all this time.
Yeah, I don't want to revamp the episode because, of course, you certainly can listen to it, but to talk about it a little bit. Let's talk specifically about how to deal with psychosis. The first thing is it's really tough, because when I experienced psychosis, I thought it was real. So I didn't think that there was anything to deal with. I just thought this was what was happening. It would be like if somebody said, "Hey Gabe, how do you deal with that shirt on your back?" I'm like, "Well, I just it's on my back, right? What's the problem?" To me, it just looks like a blue shirt, but everybody watching is like, "Dude, that shirt's on fire." And I don't recognize it at all. So I'm not going to do anything because I don't realize that there's a problem. That was very much how my psychosis felt to me. It was Lisa whom I called desperately for help one day. There was literally demons under my bed, as far as I was concerned, and I was terrified and frightened, and I called Lisa. And the way that Lisa dealt with it, of course, is we wanted to talk to a medical professional. We realize that there's no amount of therapy or help that can really make psychosis go away. There's certainly coping skills for handling it. I always throw in the hashtag your mileage may vary. Recovery looks different for everybody, but for me, I needed help, not only understanding the difference between psychosis and reality, but also getting on the right medical treatment to help alleviate those delusions. And then finally, learn coping skills. One of the biggest coping skills that I have to deal with, psychosis and things like that is I have some trusted people around me. One of which is, am I pointing the right way? One of which is Lisa over there, and obviously my wife, some other friends, and I will say, "Hey, do you see that? Is this happening?" And because they know it's happening, because I've prepared them ahead of time, they're very, very kind. And if I say, "Hey, do you see a guy in a yellow shirt?" They'll be like, "Yes, I see a guy in a yellow shirt." I'll be like, "Excellent. Is he walking down the street?" "Yep, he's right there walking down the street." "Excellent, thank you." And if they don't see a gentleman in a yellow shirt, they will tell me, "No, can you elaborate a little bit more?" And then we make a note of it and make next steps. So it's nice to have them around to help me. And that's how I've dealt with it, a combination of therapy, coping skills, and ultimately medication. Lisa, do you have anything to add from the caregiver perspective?
Well, I would just like to reiterate what you said. This is not something you're going to be able to deal with yourself. You need to go to a doctor. Like you said, Gabe, there's many things you could do to cope with it, I suppose, but you're not going to be able, no amount of meditation, no amount of coping skills, no amount of CBT skills is going to make psychosis go away. You're going to need a medical professional to help you with this. And Gabe has many symptoms from his bipolar disorder and other mental illness. And I must say that the psychosis was by far the symptom that upset me the most, by a huge, huge amount. It was the one that was the most upsetting, the most difficult to deal with, the one that I tried to hide the most. So I just have so much sympathy for people who are having trouble with psychosis, because it's so much worse, or at least it was for me, than other symptoms of Gabe's mental illness.
It's interesting. We have a moment while we're queuing up the next question. But a lot of times when Lisa and I are out in public, and I certainly don't know what the collective opinion of the audience is right now, but when Lisa says that was by far the scariest one for me and the one that I tried to hide, people were like, "Well, that was very stigmatizing. Why would she try to hide it? Why was she so afraid?" And I always try to address that generally ahead of the audience, because I didn't think it was stigmatizing for her to do that at all. I thought it was honest. She was afraid. She didn't know what to do. She wasn't responding as a mental health advocate or somebody that was trying to educate people. She was responding as somebody who didn't understand what was going on and was desperately trying to help somebody who was suffering, because I was suffering. And she didn't know what to do. And when she brought it up to people, they wanted to stop helping. They wanted to take away my job, which took away my health insurance. And it was just such an incredibly difficult time. And it was such a difficult time that unfortunately, we didn't have the luxury of thinking about it in terms of advocacy. We only had the luxury of thinking about it in terms of how do we get Gabe well. And I just always point that out, because I think it's really easy to Monday morning quarterback and be like, "Well, I'm not ashamed," because I'm certainly not ashamed now. But at the time, I wasn't ashamed. I was terrified.
Well,
there were demons literally attacking me.
I was not ashamed, and I do not think you should be ashamed, and I don't think you ever should have been, because you can't control it. You absolutely cannot control this symptom. So of all the things that you should not be ashamed of, which is of course all mental illness, but this one especially you cannot control. No amount of trying really hard is going to make your psychosis go away. So I was never ashamed, but I was worried, which is different, about how people would react to it. So I think that shame is internal, but fearing other people's reaction is different.
I completely understand. All right. Thank you so much, Katie. Lisa, are you ready for the next question?
I am. Next
I'm gonna
question.
do my Jedi thing. Ready?
He really likes that. I find it hard to cope with chronic depression. Have experienced major depressive episodes. Meds have been trial and error. Any tips and/or encouragement?
Yeah, chronic depression. I can't talk today. I don't know.
Well, I got this one.
Yeah.
I have dealt with
Lisa.
chronic depression
You are up.
I have dealt with chronic depression my entire life. Again, I have had doctors tell me that really young children can't have that level of depression. So I don't know if I'm retconning that in my brain now, but that's how I remember it. I remember being depressed from a very young age, and it is very difficult. And yeah, it's cyclical. There'll be periods, long periods, years maybe, where it'll be gone and then it comes back. And meds are absolutely trial and error. And unfortunately, there's no other system. There's no way to know in advance how you're going to react to them. You just have to have the patience and take them and wait. And then, as Gabe always points out, especially if you're taking a cocktail or multiple drugs, well, they take time to start working. And you can't try a whole bunch all at once. You have to do them one at a time. And then you have to wait 6 weeks, 8 weeks, 12 weeks to see what happens. And then maybe you're going to have to taper down and maybe you're going to have to taper back up. And it's incredibly frustrating. I will say, in terms of encouragement, I have been very stable for years now, and it took a while to get there. Gabe? I didn't plan that sentence all the way through.
That was the worst segue in the history
not
of
good at
podcasting.
I need like signs. I don't know.
I have no idea what happened there. So I want to focus just purely on the part where you said meds have been trial and error.
Don't give up, because there are hundreds of these medications. So if eventually you've got to find one that works, of just by the statistical averages.
I mean, what she said, she interrupted me to repeat what I was going to say. I mean, that's
because I thought of it first. Yeah.
Yeah. Sincerely. So often when I was going through, different medications and literally the trial and error phase, just like you, I thought to myself, well, this doctor is a quack. I mean, why do they keep giving me pills? Why don't they know what's happening? But this is how science works. They try something, they write down the data, and then they try something else. It's, trial and error makes it sound like you're blindfolded and just like throwing darts at a random target and hoping that you hit it. And that's not what's actually happening here. What's happening is it's more like before you start the darts game, you throw a couple of darts so you can get the feel of the weight and how far they sink and does the floor rock? I mean, that's why you have the practice round, because you're getting used to the darts, the board, how hard you need to throw it. It's not really trial and error as much as it is research and data and practice, for lack of a better thing, and each one narrows it down, and sometimes you have setback, just like in darts. I'm really good at darts, but yeah, sometimes I miss the board entirely, and people are like, "What happened?" And I'm like, I don't know. Let's try again, and that's the important thing to know. What I want you to know, and this is the encouragement part, I really believe that it has happened to everybody. I mean, there's got to be somebody, just because the world is vast, but the majority of us out there living with, major depression, bipolar disorder, anxiety, and on and on and on, we're not just walking in one day that the doctor pulls out the magic cure and then we're fine. If we think back, it took us a long time to figure out which headache medicine worked for our headaches. I mean, do we like Tylenol? Do we like aspirin? Do we take 2 pills? Do we take 3 pills? Do we take 1 pill? Do we take 1.5? And that's something, relatively simple, a headache. This is much more advanced. So please know that you're not alone and know that it is worth it. It takes a long time to get to the top of the mountain, but it's beautiful. It's beautiful up there, and I believe that you can make it. All right, Lisa, are you ready for the next question?
Yeah, absolutely. Let's have the next question.
I am super excited.
I know. He gets to do the hand thing.
Boop.
So Anna asks, I have experienced psychosis, and some of the side effects of medicine is terrible. Yes, absolutely.
Yeah, I hang on a second. I need to drag over my soapbox. I'll find it. I'll find it here. Buckle up, everybody. I'm about to say lots and lots and lots. Yeah, yeah. The side effects of psychiatric medications and in
Specifically
particular,
the
yeah,
antipsychotics.
the ones that treat psychosis can be, and I want to be. I want to make sure everybody hears the can be horrific. They can be very, very, very difficult. So here's what we have to do. We have to understand a couple of things. One, there's lots of different medications. There's lots of different medication combinations, and we always have the opportunity to treat the side effect. So I'm going to self-disclose. One of the first problems that I had with medication was sexual side effects. And, I was a young guy, and it wouldn't even matter if I was a middle-aged or an old guy. The bottom line is I wanted to be sexually active, and the medication was preventing that. So what I did is I went back to my doctor and I said, hey, look, this medication is doing a decent job of preventing psychosis. I'm very happy about that, but it's caused this side effect that I cannot live with. So now the doctor knows that, okay, this class of medication seems to be good for the psychosis. However, there's this side effect. Now, for me, it turns out that I was just on too high of a dose, and that lowering the dose helped clear that up. But I remember during the process, the doctor said, look, I don't want you to worry. We've got some options here. One, we've got other classes of medications to try. Two, we can lower the dose, raise the dose, etc. And three, there are, again, in the interest of full self-disclosure, there are erectile dysfunction medications that that this particular doctor has used in conjunction with. The bottom line is, don't quit cold turkey, believe in the process, get through to the other side. For me, I was very, very lucky. Lowering the dose, problem cleared right up. Yay, Gabe. But I was prepared to hang in there. I was prepared to hang in there for medication changes. I was prepared to hang in there for treating the side effect. And I had another medication that just put me to sleep. I was asleep like 22 hours a day. Good news, I had no psychosis. Of course, I also had like nothing. I had no waking time. Obviously, I got that one cleared up right away too. The bottom line is you have to partner with your doctor. You have to talk to your doctor. You have to get your doctor to understand that you are unwilling to accept these particular side effects. The last little caveat that I want to say is sometimes we might have to put up with some side effects. One of the side effects of my medication is I have a slight tremor. I don't know if it's coming through or not. I also have chronic dry mouth. Now, I am not a concert flautist. I am not a concert pianist. So I am not a fine artist. So a tiny, tiny tremor and having to drink a lot does not bother me. And that is a good trade for mental wellness. I would feel much differently if I was a fine artist. So I'm not telling you, hey, you need to put up with dry mouth, because that might not fit into your life, but it did fit into mine. Somebody celibate might not care about sexual side effects, etc. So it might not be as important to them. The bottom line is you have to get it in so that you're leading the best life possible, controlling your symptoms, and everything is working out exactly how you want. And understand, this is the most important part, understand that might take time. But yes, Anna, some of the side effects are terrible. You have every right to feel that way. I completely agree. Thank you for saying so.
And you have to find the side effects that are tolerable for you. And it's not up to anybody else. Maybe somebody else is okay with the dry mouth or the sexual side effects or whatever, and you're not. Or like Gabe said, maybe you are a concert pianist. Anyone else has this little trouble, they don't care. Well, this is going to destroy your entire life. So you're looking for the thing that is right for you. And I want to reiterate what Gabe said, don't quit cold turkey. Some of these things you have to taper up and down, and you're going to make yourself really sick. So quitting cold turkey can turn out really bad. If you've decided that's it, I'm not going to take it, whatever, talk with your doctor and see how to do that safely.
Here. Are you ready for the next question, Lisa?
Absolutely.
We're rocking it out. Before we go on to the next question, I want to pop a little thing on the screen that basically says we are looking for your questions. We want to hear from you. Ask short questions in the comments now. We will pop them up. We are live over Psych Central, This Emotional Life, The Mighty, GabeHoward.com. I mean, basically every single YouTube channel and website and that we could find, except for Lisa, because Lisa just doesn't have a social media following. We don't know what happened there.
I got a Facebook page recently.
You
Proud
have like
of me.
7 friends. It's you're killing it.
I posted a message yesterday.
I did not even see it.
I know, right?
But sincerely, anywhere you are watching, type it in. YouTube, Facebook, Twitter, Twitch, wherever. Type it in. We will find it, and we will do our best to answer it. Remember, shorter comments work better because we can pop them up without them getting truncated. All right, Lisa, you ready for the next question?
Truncated. Impressive. I am. Let's have the next question. All right. How are anxiety and depression lived? In levels of well-being, is one easier to be relieved than the other? I don't know that there's an answer to that question. I think it's really individual. It's going to be for each person.
Sorry, Lisa.
Oh, I personally don't really have anxiety. So I was going to ask you, Gabe, how you feel, but I don't know that would be super relevant to anyone else because it is so incredibly individualized.
This is where, of course, it's really, really tough. I call this sort of the suffering Olympics, trying to decide what's worse, anxiety or depression, or what's worse, depression or bipolar, or what's worse, bipolar or schizophrenia. And it just kind of, you're just like kicking the can down the road. Here's the thing that I want everybody to know. Living with mental illness, it sucks. It's awful. And I don't know that one is easier to treat. Maybe from a medical perspective, there's some argument that something is easier. But I think that how we all respond to it is different. Lisa and I are huge UFC fans. We love mixed martial arts. And these guys will like break their nose and come out for round 2. And then they'll break their orbital socket and come out for round 3. I got a hangnail once and stubbed my toe and missed a week of work. So trying to decide which is worse, I think it's just kind of like a straw man's argument. The reality is you want to address anything that is impacting your day-to-day life because you want to live the best life as humanly possible. So I don't know from a medical perspective if one is truly easier to relieve than the other. I sincerely don't. There may be a doctor watching that's like, oh, well, from a medical perspective, we've done the research and X is easier. But listen, if you're suffering from it, I don't think that if you're suffering from depression, you care that anxiety is easier or vice versa. And I think that sometimes we get ourselves caught up on the wrong thing. So what I would say is whatever is impacting your daily life in a negative way, fight that as hard as you can, move forward as slowly or as quickly as you personally can and get to the best life humanly possible and let the rest sort itself. It is truly, truly individualized and subjective, and my way is no more meaningful than yours. And I really, I'm sort of responding to it this way because I was that guy. I just walked around and talked about how bad bipolar was and how it was so much worse than this illness or that illness and how it was unfair. And it wasn't until I stopped thinking that way that I was able to make real progress and real strides. So I'm sort of responding to some of my own past, issues and trauma. And I certainly don't mean to visit that on the audience, but it wasn't until I started thinking of terms of how to move forward that I started to actually move forward. Lisa?
Oh, I would agree with that. And again, the suffering Olympic.
Agree. That's my ringtone. That is my ringtone. Oh, I would agree. Could you say I would agree with that, Gabe? Can I get a Gabe in there? That would be much better.
And I don't know either. I'm sure someone has done a study somewhere of how likely certain drugs are to work and how quickly you can get there, blah, blah. I don't know the answer on that. I don't know that there necessarily even is one. This is so incredibly individualized. And for any given person, I think the answer is going to vary dramatically.
I like the part where you just repeat what I last said and claim it as your own. That's
yeah, but see, I put it in words that are better.
That's
You're welcome.
All right. Are you ready for the next question, Lisa?
Okay, next question.
And boop.
All right. Tina Johnson Greenlee asked, have you tried pharmacogenetic testing? And if so, did it help you and your psychiatrist in making med decisions? I have to. Oh, I'm sorry. Go ahead.
No, go ahead.
Oh, I was actually going to say that, no, I'm not familiar with this at all. Help. What do you have to say, Gabe?
Yes. Yes. Yes, I have done this, the cheek swab to help decide. Now, full disclosure, I was in, it did not help my doctor find it because I was already stable. I was part of a clinical trial where they were taking stable people, doing the swap and comparing it to their medications that they were stable on, and helping to decide. I do not know the outcome of my own, like my own, did Gabe match the swab, etc. But I do know that that particular testing kit did get approved, so I got to figure that the majority of people, if not myself, also had extraordinarily good luck with it. I love this. Remember what we talked about earlier with the trial and error? Everybody thinks the trial and error is just, randomly throwing darts with a blindfold, and when in actuality it's data being collected, it's science. We're trying to figure out the best way to move forward, making educated guesses. That's what the practice round is for. I think that this DNA swab eliminates some of those steps and gives your doctor more subjective things to go, or I'm sorry, more objective. Yeah, thank you, Lisa. More objective things to go by, because they have actual hard science. And I think, some of this is very a soft science. It's the doctor listening to you, asking you questions, and then making educated guesses based on this, whereas this is very objective. Swab, DNA, boom. This is going to work. This isn't. This is going to have potential side effects. I mean, nothing is 100%. Remember that. No black and white thinking here. And
I want to clarify that,
yeah.
Gabe, that this is not
Please.
going to be 100%.
Yeah.
You can up your odds, you're going to get better odds of getting a good result, but it's never going to be 100%.
It shortens some. One, thank you so much, Lisa. Yeah, I can't.
It's not a for sure
for the day. I'd like to.
Yeah, that will be an exciting day. Maybe we'll live to see it.
I always try to point out how mental illness is just like every other illness. And the reality is there's no illness where you just walk in and you're like, oh, you have X disease? Here, this is the cure, 100% guaranteed. Nothing. Again, remember the aspirin analogy? That's a headache. And even that has multiple options and multiple strengths and extra strength and no strength and 2 pills and 3 pills and 1 every 4 hours, 1 every 6 hours. And that's a headache, right? So this just eliminates steps and gets us there closer and gives the doctor some things to work with. So I think that good expectations are important, and understanding that mental illness, like all illnesses, involves a lot of input from both patient and doctor. Yeah. And there's no magic cure for anything. Literally anything. I go back to the headache analogy a lot. All right, Lisa, are you ready for the next one?
Okay, next question.
Do you want to be the Jedi?
No, I don't. I feel like the Force doesn't work in my house as well as it works for you. So I wouldn't want to mock the Force in this way.
All right, here we go. And the next question now.
A therapist said I have BPD and bipolar. However, they are unwilling to change my diagnosis from GAD, which is generalized anxiety disorder. I don't understand.
Borderline personality disorder.
Oh, right. I didn't define it. Thank you, Gabe.
You gave one and not the other. That's...
Sorry. I don't understand the issue with treating for what I have rather than what they would prefer I have.
So these questions are always very, very difficult because we're not doctors. We didn't treat you personally, and yeah, that's really, really tough. I think what you have here is and again, I'm gonna assume some things. So I want to be very, very clear. I'm making some assumptions. What you have is a disagreement between practitioners. It sounds like your therapist believes and has diagnosed you with borderline personality disorder and bipolar disorder. However, another doctor feels that you have something different, and I'm not sure. I'm not sure who is right. I mean, they're both professionals. Now, if there's only one doctor that's involved and that doctor is continuing to treat you for the wrong thing, well, that's certainly medical malpractice. If they've changed your diagnosis but won't change your treatment, I think it's very, very important to ask why. Why have you changed my diagnosis but not my treatment? Understanding that sometimes treatments overlap. Again, going back to my headache analogy, I take 2 aspirin or painkillers for a headache, and I also take the exact same regimen if my back hurts. So even though my diagnosis changed from headache to backache, the treatment is the same. So I think that might be important. I think that there is a real opportunity for patient advocacy here, because it sounds like that there is something that you do not understand, and it doesn't matter why you don't understand it. You as the patient don't understand, and this very much needs to be cleared up so that you can have faith in the treatment and what's happening. So I feel that that's extraordinarily important for you to advocate on your behalf, talk to your practitioner, and if that doesn't work, perhaps look for a patient care specialist. Lisa knows all about patient advocacy, so I'm gonna kick it over to her.
Well, keep in mind that depending on where you're at, most medical practices, big practices, hospitals, they do have that patient advocacy office. So you can actually call someone and have them kind of help you navigate any difficulties or questions you're having between you and your doctor. You are in charge. You are the healthcare consumer. Now, that doesn't mean to say that you want to overrule your doctor, be like, oh, no, I know best. Well, that's what medical school is for, so that they have this information. But don't be afraid to advocate on behalf of yourself. You know what's working for you. And doctors are not gods, as much as some of them may think that they are, and some of them are jerks. So just like any other professional that you're interacting with, if you're unhappy with the service that you are receiving, and again, as Gabe said, this sounds like something where you have a lot of questions that have not been answered. So maybe it would help if you schedule an appointment for just this purpose and tell the person scheduling, I'm scheduling this appointment specifically so I can get these questions answered. And I don't know how applicable this is to this specific situation, but I've always felt like the diagnosis isn't as important as what's working. So I understand that it's important to have a diagnosis because it gives you somewhere to start. It gives you a frame of reference, somewhere to go from. But ultimately, it really doesn't matter what you call it. If your treatment is working for you and being successful, then who cares what the letters are? Gabe?
I think that, yes, I think that it is absolutely important to understand your treatment. It doesn't matter if they're 100%
completely
right, they have all I'm going to assume that they are 100% right, and there's just a misunderstanding. You got to clear that up.
Part of the doctor's job is to explain these things to you. What are you doing? He's unhappy. Who knows? A part of the doctor's job is to explain these things to you. And if he has not done that successfully, that good point. If that person has not done that successfully, they need to alter how they're doing things.
Exactly. Listen, here is a hint on getting information out of your doctor. When you make an appointment or your therapist, say that I do not understand my treatment and I need to understand in order to be invested in it. I would like to make an appointment to better understand my treatment, and I have written down my questions in advance, and I will come in with those questions.
Yeah, be prepared.
I do not feel comfortable leaving until I understand the answer to all of these questions. And ask if you can bring a trusted person. I know that when I was really, really sick, some of the things I just frankly did not understand. And it was very, very helpful to have Lisa there, because the doctor would explain it to me and I wouldn't understand it. But Lisa, she was an excellent bridge. She understood how to speak Gabe. So she did understand, and she would say, Gabe, what they're saying is it's like X. And I'd be like, oh, okay. And see, a doctor would not necessarily have that analogy. So there are some quick hints and tips.
It can also be really stressful when you're in that doctor's appointment. It's all about you. And maybe you're just not able to absorb all of this information. It's just very stressful. So it can help to have someone with you as a buffer, but also because there's just so many things coming at you, and then you can go over it later.
Yeah. All right. Are you ready for the next question there, Lisa?
Mm-hmm. All right, next question.
And boop.
What are some Sorry, I'm not speaking correctly today. Courtney Brown says, what are some coping mechanisms for dealing with suicidal ideations?
Thank you so much for asking this question. One of the coping mechanisms is to talk about the suicidal ideations. Talk to the people around you and talk about how this is impacting you and how it is affecting you, and choose people wisely. Right? Don't choose somebody that's going to say, "Oh, you're so pretty and you have so much to live for," or "Oh, why are you complaining? You just got that new car or house or job or dog," or whatever. Talk to somebody that understands. This is where peer support is extraordinarily valuable. One of the coping mechanisms that's really good is what you're doing right now. You're asking others for not only advice, but arguably support. I think it's important to understand that other people have been there. I've been there. I know that Lisa has been there. I don't mean to speak for you, Lisa.
I have.
But I'm gonna. And this is a coping mechanism. So many people try to internalize it. They try to handle it themselves. Don't. That in general allows it to ruminate, fester, and grow. Other coping mechanisms are, of course, the suicide hotline. I'm a huge believer in that. There's the texting hotline. I am a huge believer in that one as well. Right there it is.
Thank you.
And lastly, there's online support groups as well. Not only from psychcentral.com, but also the Mighty. And, again, participating in stuff like this. Finally, therapy will teach you even more coping skills. It's very important not to ignore it. That is my number one advice, that talking about this symptom, asking other people, I think that's really, really healthy, wise, and it's allowing you to get ahead of it. There's so many people that want to pretend that it's not happening. I want to discourage that, because it is happening, and it's real, and it's worthy of a discussion, and it's worthy of support. The last thing that I want to say is, of course, if it moves into the danger zone, past ideation, if you have a plan, if you are in imminent danger of harm, please go to an emergency room, call your doctor, call 911, get help immediately. You are so valuable to the world, and we need you here. But your specific question was about suicidal ideation. So I hope that gives you some places to start. And thank you so much for asking that question and being willing to talk about it. It's very, very valuable.
And don't forget the role of medical care. I had so much suicidal ideation for so long that I didn't realize how apparently important that was. It just seemed like a very normal state of life to me. So no, apparently that's a symptom that you need medical care for. And I was willing to dismiss it. So yeah, Gabe, don't dismiss it.
Lisa, thank you so much. All right, you ready for the next question?
Mm-hmm.
And boop.
All right. Kimberly Madison asks, is inpatient treatment needed for ED treatment?
So
I'm
is
it
going to assume
emergency room, maybe? Oh, I didn't get that. Good one, Gabe.
I'm assuming that it is not erectile dysfunction.
That was.
Yes, is inpatient treatment needed for eating disorder treatments?
Maybe.
Yeah, and just FYI, our wonderful long-suffering producer, Camera, who is awesome, she just clarified that it is eating disorders. So, Lisa, do you want me to go first, or do you want to go first?
Well, I could just say that, yeah, maybe, depending on how. Just like any other illness, it's like saying, well, do you need inpatient care for a broken bone or a car accident or cancer? Just like any other illness, things have levels of severity. Maybe there certainly are inpatient programs if your eating disorder has gotten to the point where that is the type of intensive care that you need. Yeah,
I want to echo everything that Lisa said. Everything's on a spectrum, right? It's just like with I'm going to use bipolar disorder because I have bipolar disorder. At one point, I did need to be inpatient. I had to be literally hospitalized. At other points, I needed to have intensive outpatient where I slept at home, but I got help all day. And then at other points, I needed to see a doctor every other week. I needed to see a therapist once a week. And then as a disease process, as I reached recovery, et cetera, I needed either more or less. But yes, inpatient treatment for eating disorders has saved so many lives, and it works absolute wonders. And I believe in inpatient treatment. I know that it is scary and it is traumatizing, and I'm not saying that it's not any of those things, because it's all of those things. But for many people, myself included, it absolutely saved my life. Look, nobody likes going to the hospital. Forget about mental health, mental illness, and eating disorders for a moment. If you were in the hospital for 5 days to have surgery, you wouldn't feel good about that either. It's not cool. It's like being at the dentist overnight. It's unfun. I don't know what kind of dentist you're going to where you're like
an overnight dentist. But I suppose you could have medical emergencies involving the mouth or teeth that need inpatient treatment, just like any other thing that's going on with your body.
All right, Lisa, are you ready for the next question?
Mm-hmm. Next question.
All right, and boop.
He just loves doing that.
I
All
do.
right. I know. Zachary Haywood asks, what do you do about stigma and bullying and being bullied? I have PTSD.
Yeah, so stigma's a real not
Sometimes
being
worse than the disease.
yeah, not being able to swear is very difficult for me. You can tell. Uh, there's one of the things to do about it is to get away from the bully, which is easier said than done, and I hear it even as I say it. If there's anything that you can do to get away from the bully, and by get away, I mean either shut the bully down, like if it's somebody at work, go to human resources, assert your rights. If it's somebody in your family, go to another family member and say, look, I need your help in getting this to stop. Ultimately, I know many, many people who have had to cut off friends, family members, switch jobs, etc., because of the bullying nature of some of the people around them, and it's unfair, and frankly, it's just unfair. I don't think there's any other words that I can say other than that. It is unfair that you have to deal with this. It is unfair that people think that they have the right to bully somebody because they're sick, and I'm frankly sick of seeing this in our country in general, where we just have bullying over race, religion, gender, and now sickness. I mean, none of this is okay, and I don't understand why this happens over and over again. And I really struggle giving any sort of advice when I think to myself, why is this even happening? Like, can't we just all be adults? But it's a struggle, and I'm very, very sorry that you have to go through this. I truly, truly am. Lisa?
Oh, yeah, absolutely. And sometimes it's amazing and it's so unfair because you feel like you can't control having mental illness or having PTSD. And on top of everything else, now you got to deal with this, something that should be not there, something that society should be able to control. So, yes, it's stunningly unfair. And it's unfortunate that sometimes there are people in our lives who aren't the greatest. They aren't bringing the greatest energy or thoughts to us or support. And maybe we do need to let them go.
It's always tough. Sometimes people ask me, like, should I cut off family members who are doing this? And yes, you should cut out toxic people who are doing this, including family. If you have made the boundaries perfectly clear and they are continuing to push them, it may be time to set up stricter boundaries. You can certainly try it for a matter of time, try it for a few months, stop answering phone calls, stop going to family events, and see if this affects change. These are not easy things. And I want you to know that I recognize that these are not easy things. And I am truly sorry that you are going through this. Lisa, are you ready?
Yes, I am ready.
All right.
Absolutely. Next question.
You say absolutely at the end of everything.
Well, but see, I was trying to do different words. Now you make it complex. All right, next question. Okay, Ellie Stanley says, I suffer from PTSD, anxiety, and clinical depression, so I feel like I don't know how to support my sister the best. Mental illness can make it difficult.
Yeah, actually, I think this is kind of a perfect one for us. Lisa, I was diagnosed with bipolar and anxiety disorder. You suffered from major depression and suicidal ideation, and you were thrust in the role of supporting me.
Oh, I hadn't looked at it that way. Yeah, good point. That is a good question for us.
What things helped? And I'm thinking, I'm kind of going back and remembering some of the stuff you do, but I don't want to step on your answer. How, in spite of the fact that you were also living with severe and persistent mental illness and had your own issues, how did you also support me? What were some things that you did?
Well, I would say that this is the same question you would say, or the same set of advice you would give to any caregiver. They have 1,001 groups for caregiver support if you're caring for your loved one with cancer or any other serious illness. And one of the main advice is you got to take care of yourself. You're not going to be able to help her at all if you become so incredibly sick that you're incapacitated. So it sometimes feels selfish or yeah, I'll go with selfish. It feels selfish or unfair or mean-spirited to do things for yourself. You're like, well, how can I possibly take this time and do all this? Oh, look over here. She's doing so terrible. Well, but you're not helping anybody if you exhaust yourself, and then you can't support her.
one of the things that Lisa was really good at looking back, and I didn't realize at the time, is she engaged other people. I mean,
Peer support is very helpful.
we we sort of had a joke in our marriage where Lisa would say, "Hey, I'm gonna go shopping all day," and I would say, "Okay, well, who's gonna babysit me?" She never actually got a babysitter.
Yeah.
I want to be very, very clear. I would just start calling up like my friends or family members, and I'd be like, "Hey, Lisa's going shopping all day with her friends, and I'm a little worried about being alone for 12 hours." And somebody would say, "Oh yeah, Gabe, that's no problem. Let's go out to dinner." And Lisa would
So the
give me
idea being
like a lot of
recruit
advance
others.
notice. She wouldn't like wake up that morning and say, "Hey, I'm going shopping." She would say, "Hey, in a week and a half on Saturday, I'm going to be shopping all day." And then I'd start making plans. And now would be a good time to tackle the honey-do list or whatever. Just we worked together, but Lisa made sure that she got those things that she needed and communicated to other people how best to do it. And finally, you can't pour from an empty glass. And I know that's what Lisa's saying. You can't pour from an empty glass.
I always forget that one.
Yeah, if you run yourself ragged, that's not going to help.
And I think what you're also trying to say, Gabe, is that reach out. Your sister's in a bad way. Can you encourage her to reach to other people for support? Can you bring in other people? Do you have other friends, family members, et cetera, that can share some of that burden of support with you?
Yeah. All right. Are you ready for the next one, Lisa?
All right, absolutely.
We are nearing the end. This is probably the last one.
I didn't even look at the time. You're right. Getting on.
I know. All right, Lisa, you ready?
Uh-huh.
Boop.
Is inpatient care needed for severe depression, or can you make it through the dark hole with a therapist and a doctor? I'm in a dark place. No harm to self or others. Well, go ahead, Gabe.
Oh, so it may well be needed. And I answer a lot of these questions pretty much this way. If you have to ask. Sometimes it's, it reminds me of, when I was a kid and my mom would look at like a wound on my brother and think, I wonder if he needs the emergency room. And the people around her would be like, the fact that you don't know immediately that he doesn't means that he does. And so yes, if you have to ask, you may well need inpatient care to make it through the dark hole and get to the other side. That said, you might not. My brother, he got hurt a lot, by the way. My brother had many an injury that did not involve medical attention or only involved a quick trip to the urgent care, or my mom was able to bandage up. He was wild. He had no fear. He fell out of trees. He rode motorcycles. He got hurt all the time. But I do want to caution that if you're wondering whether or not you need it, it sounds like maybe somebody floated the idea to you and you're thinking about it. And I would err on the side of caution because, the worst case scenario is you go get help and you got too much help. Getting too much help is absolutely preferred to not getting enough. That said, I don't want everybody with severe and major depression to think that the only way through is inpatient care, because it's not. Working with a doctor, a therapist, support, etc. I have managed many a depressive episode not having to go inpatient. But I've also needed inpatient and intensive outpatient to manage many an episode as well. So the your mileage may vary definitely applies here. But listen, you're saying that you're in a dark place. And I think that you need all the care that you could get. And I really want to stress it's preferred to get too much care than not enough care. Please take care of yourself, sincerely.
Yeah, absolutely.
All right. Well, I think if we have a quick one, we can do it. So, quick one.
All right. Amanda Pugh asks, why do doctors vary on what medications, if any, are safe for breastfeeding moms?
Oh, man. I kicked the soapbox out of the way too soon. So listen, this is my pharmaceutical company and research and health rant of the day. It will surprise you to know that even though 50% of the world are female, that drugs are not tested on women. Drugs are largely tested on men because then they don't have to worry about things like fetuses and babies and things like that. And for whatever reason in our society, no doubt misogyny, men are considered the baseline. So a lot of drugs don't get tested on women until the very late stages. And drugs are almost never, and I feel very confident that I can say are never clinically tested on women and are never clinically tested on breastfeeding women because, I mean, in a way, I sort of understand this one. Let's say that you got 100 breastfeeding women together, you put them on a drug, and yeah. And they're like, oh yes, it definitely causes X problem in women. So a lot of the testing is real world, meaning they have prescribed it and they have waited to see what data comes back as they're prescribing the medication. And this is why medications get pulled often, because there is some side effect that didn't show up in a clinical trial, maybe because they weren't testing for it or looking for it, or on and on and on. So it's very, very difficult. That's why doctors don't have data unless they have a drug that is 5, 10, 15, 20, 25 years old. And some doctors are willing to risk it more than others. And that is your variance. Sincerely, it's sort of a messed up system, little bit. Lisa?
Yeah. We like to think that everything is very precise and well known and that doctors have all the answers, but medical care is not an exact science and there just isn't data out there. So a doctor has to decide on their own kind of, is this a good idea? Is this not a good idea? Is this going to work? Is it not going to work? And then of course you have to decide too, what level of risk are you willing to assume? How much are you willing to take on? Is 0 your answer? So they're kind of out in the cold all on their own trying to figure this out on an almost case by case basis. So you can see where there's going to be a lot of, I don't want to say disagreement, but maybe different answers.
All right, Lisa, we have like 2 minutes left, so we have to answer this question in like 2 minutes.
Okay. All right.
And go.
All right. Courtney Brown says, what is the process of getting into a partial hospital program?
Oh, this is a really good question. Generally referral. I got into the partial hospital program. I was in the intensive outpatient treatment or partial hospitalization twice. One was stepped down when I got out of the inpatient unit. It was recommended that I go to the partial hospitalization. And so that was sort of how I got into that one. The second time, I believe, was my therapist recommended that I go and put me in it. Other ways that people get in are they go to the emergency room and they're not quite ready for, or not in need of, I shouldn't say ready for, they're not in need of inpatient, so they're recommended for the out treatment program. They can be referred by a general practitioner, they can be referred by a psychiatrist, a psychologist, a therapist, etc. It's generally a referral. Now that referral, again, can come from going to the emergency room, going to a mental health clinic, things like that. Now in your area, you might have psychiatric hospitals, and you might be able to just apply directly as a patient at a psychiatric hospital. It just depends on what is happening in your area. I live in Columbus, Ohio, and there are a few of those hospitals where you can just literally walk into the lobby and apply without a referral, but some of this does depend on your personal insurance, payer source, etc. So that is really the way. You need to have a conversation with your therapist, psychiatrist, psychologist, or general practitioner, or go to the emergency room. Lisa, we are out of here.
Okay.
All right, listen up, everybody. My name is Gabe Howard, and I am the host of the Not Crazy Podcast. Her name is Lisa, and she is the co-host of the Not Crazy Podcast. You can find the Not Crazy Podcast on your favorite podcast player, or simply by going to psychcentral.com/notcrazy. We'll see everybody next time. Thanks for